Hi, my name is Michelle, and I'm with Legacy Insurance Brokers. Today on Medicare with Michelle, we're going to go over the four parts of Medicare. First part, Part A, hospital care. This is your hospital coverage, so if you go to the hospital and have to be admitted or whatever, this is your inpatient care, this is hospice care. It can cover some home health care, some skilled nursing facilities. I should let you know that many of these things that are covered, you have to meet certain criteria first. So you want to really look at your coverage before just thinking that you're going to get covered for whatever it is. Then you have your second part, which is Part B, and this is your medical coverage. As you can figure, this is when you go see the doctor. So this is your preventative care or medically necessary care. So you've got the flu or something, you have to go see your doctor. The two combined, so Part A and Part B, make up Original Medicare. Now with Original Medicare, it doesn't cover everything. So you're not going to get the kind of coverage that you need for dental or your glasses, eyewear, hearing aids, things like that, acupuncture. Those kind of things lead you to the third part, which is Part C. In Part C, you may have also heard people say Medicare Advantage. That's Part C too. So Part C, Medicare Advantage, covers A and B, sometimes Part D, depending on the plan, and that's prescription, and we'll get into that in a second. So A and B, sometimes Part D, and many of these plans, depending on the zip code that you're in, will cover your dental. It'll cover some eyewear, hearing aids, fitness benefits, over-the-counter allowances, and some of them cover acupuncture and things like that. So there's many benefits that come along with Part C Medicare Advantage plan. It kind of combines everything almost in one. Now, Part 4 or Part D, which is your prescription coverage, this you can get as a standalone plan, so all by itself, or you can get it in a Medicare Advantage plan, a Part C, depending on where you're at and what these plans offer. So when choosing a Part D, it's important that you look at the formulary. Each plan has their own formulary, which will let you know what prescriptions they do cover. So you want to check and make sure that your prescription is on that formulary. And you also want to know where your prescription lies in the tiers, because if your prescription is a tier 1 drug, then it's going to be less expensive for you. But if your prescription is a tier 4, it's going to cost you more. It also depends on the pharmacy you use. So we have the four parts. We have Part A, hospital coverage. Part B, medical coverage. Combined together, Original Medicare. Doesn't cover everything. We have Part C, which is Medicare Advantage, covers Part A and B, sometimes D, depending on the plan, and many other benefits. And then you have Part D, which is your prescription coverage, and as you guessed, covers your prescriptions. So those are the four parts of Medicare. If you have any questions or need more information or would like to look further into these, you can give us a call. I'm always ready to help. The number here is 800-427-9781. Also, if you want to learn more about Medicare, subscribe, follow us, and check us out. We'll have more videos and break down different parts further in some of our next videos and other information coming really soon. So I hope that helps. Many of you who are getting all this mail, now you know what the four parts are. You understand when they're saying Part A, Part B, Part C, Part D. You know what those are. I, again, want to welcome you to call us, 800-427-9781, and we will help you in any way we can and answer any questions you have. subscribe, like us. See you next time. Thank you.